In a dynamic blend of spoken word music and open dialogue, the Bureau of Health Education has unveiled a fresh and innovative approach to health promotion. The initiative, titled Health Expression, received support and funding from Taiwan ICDF and was the brainchild of Family Life Educator Janelle Dupre and seek to reshape how health messages are delivered and received. Hosted at the Entrepreneur Human Resource Center, the event brought together a diverse group of creatives, poets, musicians, and health advocates united by a common goal to foster deeper connections and stimulate meaningful conversations around health through the power of artistic expression. Health Expression was designed not only as a platform for performance, but also as a safe space for dialogue and reflection. Senior Medical Officer for Non-Communicable Diseases, Dr. Shanna Sear-Filbert, shared her hopes for the future of health education in St. Lucia, emphasizing the importance of unity and collective action in driving meaningful change.
I'm hoping that this is the beginning of things to come. I think we need to rethink health messaging and health education and health promotion, right? And we need to make it real. Miss Gillard Weeks made it real, that the testimonial was, did you feel her experience? I had never sat and, listened like that. It was very engaging, very impactful. And I think we need to keep health messaging real. We're very grateful for our NGOs. Claudine, we saw you. And we hope that we will collaboratively be able to have more of these expressions, right, which engage the young, the not so young, and the older, all right, as we come together and we make that change.
Health Expression also featured an open dialogue session led by Nadia Gaylord Weeks, president of the St. Lucia Renal Association. She shared her personal journey of living with kidney disease, offering the audience profound insight into the realities faced by patients.
My reason is still a mystery, because I got sick when I was 27 years old, and my mom had kidney failure. And her aunt had kidney failure. So it's possible, because to this day I don't already have a diagnosis. So it's possible that it is hereditary, passed down from generation to generation. So after finding out the diagnosis of impaired renal function, I was told to stay off a few foods. Anything fatty, greasy, foods high in potassium, foods high in phosphorus. By foods high in potassium, I mean like things that we have in St. Lucia, mangoes and passion fruit and pineapple and all the nice things that we like. I had to stay away from these things for a little while. And after getting my diagnosis, 6 months later, I began dialysis.
The event also featured powerful performances of poetry and spoken word delivered by students from the Castries Comprehensive Secondary School and St. Joseph's Convent. Local artists Glenn Shalry and Ngozi further elevated the program with their performances.
The world is a hum, a vibrant, buzzing thing. But inside, a quiet storm begins to sing.
St. Lucia, we sing the anthems of resilience, yet our people collapse under the weight of systems stretched too thin, of medicine priced too high, of bodies burdened by diseases we could have prevented if only knowledge and access walked hand in hand.
Health Expression underscores a growing recognition of the importance of creativity in public health education, especially in reaching younger audiences and underrepresented communities. From the Communications Unit of the Ministry of Health, Wellness and Elderly Affairs, I am Onika McCoy.